the governor's office, so we're in a little unusual circumstances today, but everybody's here. But one of the things that was a priority of the governor's office and many of the legislators was to do House Bill 1511 and 1452 into law, which is the military reciprocity bill that we're going to be signing here just in a few minutes. I want to thank Representative Steve Lynch for helping with this bill, Representative Nick Schroeder for the co-sponsor of it, Senator Justin Brown in his area, and Senator Bob Onder. All of them had a lot to do with this bill, but it was a great honor for me to be able to get this through the legislation today, especially as a veteran. And one of the things we do know when the spouses come along with their military families, how important that is. And number one concern that the spouses have is what are they going to do about jobs when they get here. So with the reciprocity bill we're doing today, we're going to be able to do a lot of pieces of the legislation and the certificate part of it. We're going to get to not do for those spouses, and they're going to be able to go to work a lot faster than what it had been in the previous. And so we're going to be able to waive a lot of that bills there. But military advocate Joe Driscoll's here today. Joe has did a tremendous amount of work on this. Me and him was in Fort Leonard Wood and across the state talking about this before the COVID-19 issue. But I'm going to let Joe come up and say a few words this morning. Joe?
Governor, thanks very much. I'm very happy today, to be here today on behalf of the 16,000 active duty service members, their families, and especially their spouses to thank you for signing this really important bill. Your signature means that Missouri joins 14 other states around the country. There are now 15 that provide this full license reciprocity for military spouses who move from one state to the other. Thank you again for making this one of your priorities. I think it shows as to your commitment. I also want to congratulate Representative Steve Lynch and Senator Justin Brown, whom the governor made reference to a few minutes ago. They had some dogged determination in order to get this bill passed and to get it done before the legislature went home for a while. I'm proud to note that this was the first bill to pass during the session and one of only 2 non-appropriation bills that the governor's been presented with this year. In a nutshell, what the legislation does is allows active duty military spouses who hold professional licenses in other states to become licensed in Missouri and even allow them to make application for those licenses before they get to their new duty station here in Missouri. In the past, the state only issued courtesy licenses, that is, licenses that were temporary, and then those military spouses would have to provide further evidence of their education and qualifications to licensing entities. The new law is important for 2 reasons. One is it shows that we're being a good partner with the military. We have lots of military installations and locations in our state, and it is very important that we underscore our commitment to them. In fact, I know Secretary Mark Esper and the military service secretaries are paying very close attention to which states do and which states do not enact this legislation. And in fact, they've indicated that this will be considered in future basing decisions when they're talking about locating military missions and in additions to what they have around the country. The second reason that this is very important is when our economy starts returning to some sort of normal footing, these military spouses possess the expertise that we need in order to fill the jobs that our state had available just a few weeks ago when our economy was normal, and indeed will be returning to that normal situation again. Governor, as you made reference, I'm thinking back to January 21st when you made that trip down to Fort Leonard Wood to visit with the spouses of soldiers and Marines and airmen to get their views on what it was like to live in Missouri and perhaps to get their views on quality of life here in the state and what the state could do to do about that and improve it. And I know they appreciated you asking the question, but it was really clear from their unvarnished comments that they thought probably the most helpful thing that you could do was to make sure that they could work in their chosen professions. I think by signing this legislation, you've not only gone a long way to improve that quality of life and meet their expectations, but you've also expanded our professional workforce and made our state an even more friendly military place to be in this country. So I thank you. I think this is a great addition to the laws in Missouri, and it'll have good, long-lasting consequences. Thank you very much.
Joe, thank you very much. Thank you for all your hard work. I'm going to do the official part of this real quick. So Kelly, if you want to hand that to me, and Joe, if you want to come over, just keep the 6-foot distance, and we'll sign this into law. That makes it official for all of us. Also today, Dr. Williams is here today. Director Williams, Dr. Williams, a lot of those titles he has over there. He'll be here to answer questions today on any things you might have on testing, any of the plans we're going to do to increase testing. He'll be here to answer that. Director Carson's also here to answer anything on the PPE side of it, the law enforcement side of it, to take questions about SEMA or FEMA. Today earlier, we've been working on, actually I talked to the federal delegation earlier this morning about kind of their plans of about the package they think is going to be coming down that they think they're going to get passed today in Washington, D.C. We'll see. They had high hopes for that when I talked to them. Some of the things will be coming our way. And then I think the other thing, we've had a long discussion with them of our plans about reopening Missouri and how we were going to start the process of that. Again, last week when we made that announcement, we've been working full steam on that, trying to make sure that we're getting things in place, some guidelines for the people of Missouri. And I think the two things we're focusing on this week, our two priorities, is COVID-19, still doing what we can against the virus, and then making the plans to reopen the state of Missouri. So with that, let me just give you a little update on the COVID-19. As of 2 p.m. today, there have been 5,941 positive cases of COVID-19 in Missouri, including 189 deaths. Over 57,000 people in Missouri have been tested so far. So that's the update on that. So with that, Kelly, let's just open it up for questions. Yeah, I think you're going to see, we're going to take a look at open, we're going to look at recreations, we're going to look at sports, all the possibilities to open up the state. We're going to take a look at those things. I think one thing you're going to see is the guidelines of social distancing. That'll all play part of how we're going to open up the state. It'll be part of it. But all those things we're going to take a look at. We're right now in the process of kind of giving guidelines that we've got that we're working on every day. We hope to talk and again, we're working on the guidelines. When I say we are working on that, we're talking to county commissioners, we're talking to mayors, we're talking to executive directors, we're talking to the restaurant industry, the manufacturing industry. A lot of people are having a lot of input into this of how we foresee that we're going to be able to open up the state of Missouri and still make sure that we got the consumer confidence out there that it's safe to be out there. I will just say this as we work through this process. I think it's important to realize, no matter what the regulatory side of it might look like, I think we're a long way from people just all of a sudden going to leave their homes and go out there and feel like it's okay to go out into crowded areas and things like that. I think there's going to be a lot of self-discipline to that, to the everyday person. But what we're going to try to do is build the guidelines to give it to the counties, the cities across the state. That's a blanket policy. And then they're going to be able to, if they want to do something a little bit more stricter, they can. Upon that. But what we really want to do is give everybody the guidelines to start the process. So if the county wanted to issue an order, it would still be in effect after the order expires? I'm sorry, what was the first part of it? If a county issues an order, would it be in effect after the order expires if the county wanted to? Well, if the county does an order, whether they do it now or whether they do it after the new one, they can do stricter guidelines. So they could have one in place. It was stricter guidelines of what we can. It just can't be any less guidelines than what we are. Yeah. You'll have to step up here. I can't hear you that far away.
Do you have an ETA on beginning phase 1 of reopening and also phase 2 of reopening?
Yeah, we're working on that now as we speak. We're working on it. So we hope sometime towards the end of the week we'll kind of finish up the guidelines of it. And then next week we hope to be able to put that out to we're going to want to put it out to the county commissioners, the mayors, and the people in the local areas as soon as we can. But we hope by next Wednesday, we'll be at the point where we'll have things pretty well in place for people to view that.
Governor, over 200 people gathered outside the Capitol today asking for you to reopen the economy. They did single you out specifically to say that your stay-at-home order went beyond your constitutional powers and to say that you were infringing on their liberties. How do you respond to that criticism?
Yeah. Look, we've been doing this for weeks now, for months. We announced last week we were going to open up the state. So, I mean, I get them protesting today, and that's fine. They have every right to do that. But, what we've been asking people all along is to stay home. That's what we're simply doing and going with the guidelines of the state. They have every right to be out there. We announced last week we're going to open the state. We haven't changed it. We're going to continue on that plan. Yeah, I just learned about that today, much like I just read it earlier today. I was informed that took place. So, I'm not sure what that's all about. I mean, it's evidently we're going to sue China for that. So I'm not for sure what the Attorney General was. I hadn't talked to him about that, but that's fine. I'm going to let Kelly kind of do the question that way. And let me just say this. I'll make sure everybody today, I'll be down here where everybody will get to ask their questions. So we'll just kind of go through this as we can. Michael? I was not. I mean, we've been busy all day today. I've been on conference calls and meetings all through the day. Matter of fact, I seen them out there somewhere, I don't know, this afternoon, early this afternoon or something, but it's a pretty day out there. It's a beautiful day. I kind of envied them from that part of it, but that's fine. They're out there protesting. I mean, we get people protest the Capitol all the time. And so the first part of the question was, get into a little more detail. Okay, look, for the most part, we're going to try to open things up. I want to be careful saying everything. We still got to deal with things like the nursing homes. We got to look at things where there's high risk. You still got casinos we're in part of discussing. The majority of the businesses, especially the service area, whether that's restaurants, whether that's beauticians, whether that's barbershops, whether those are box stores, will all be open in our guidance. We'll give them the opportunity to open. After May the 3rd, yeah. And, I think the other thing, in fairness to the business of the state, as I've often said, it's very difficult just to go out there like on, say, Sunday, May the 3rd. All of a sudden I say, okay, you can open up tomorrow, and they're not for sure. It's going to take a little bit of time to get people back to work. They're going to have to call employees back in. They're going to have to get supplies for a lot of them and things like that. So, again, it's why it's important to me to work with the associations and to work our way through this. But there's a plan in place, and I think we're going to be able to execute that plan. And then it'll be an ongoing process. So I don't want to think just because the way we open up, let's call it phase one, whatever you want to call it. But, we're going to have to work our way through that and make some adjustments and see how we do this. But for the most part, we're going to open up businesses in the state. We're going to put as many people back to work as we can.
Governor, you've been emphasizing the importance of social distancing. Dr. Williams, you have as well. Today, many of the protesters were in crowds and they weren't wearing masks. What are your thoughts on that? And Dr. Williams, if you could just answer this as well. Was that potentially a dangerous situation?
Yeah, Dr. Williams, come on up. You can answer that.
Thank you for the question. Yeah, again, the virus doesn't differentiate between why you're gathering. It doesn't know the difference. And so we just, strongly for your own safety, that, as the governor said, to protest is fine, but you need to do it responsibly. Because as we've said all along, and the governor said all along, it's not, not only you who could get infected, but you could infect others. And so we would just, at any type of gathering, and people call me and say, can I waive this, can I waive that? And I go, I'm really thinking about you when I say, no, you really need to practice social distancing, whether it's, again, less than 10 people, 6 feet, and if you're in a situation where you can't do that, then wear your mask. But that's for your protection, as well as those around you, your loved ones and others.
Doctor, do you think that protest was safe? Governor, you mentioned that you talked to the federal delegation today.
Yeah, you know what? Well, I have not, but my staff's working with him daily on that, and they're briefing me on that. But I think it's important to know that the stimulus money, part of the stimulus money, has arrived. About half of it's here. There's still a half of it we're waiting on. The 24th, they're supposed to have the complete guidelines on that. So shortly thereafter, once we get that, we'll be trying to make the process through their role and through the office they're much more on the advisory role type of it, just trying to go through this. And it's really just about work. It's about having the people able to go through this. Why I asked the treasurer to go through there, it's just simply because our office is pretty overwhelmed right now with the unemployment, all the other things going on. But again, we're just reaching out for help, so it's on that.
And I believe Jacqueline asked me this yesterday, but I'll ask again, what is the latest with the fiscal year 21 budget? And when might we see some of the...
Yeah, you know, the legislature is going to be in here next week to work on the 21 budget. You know, I think one of the things we got to realize is we're not for sure what the federal stimulus part of that's going to be. So that's kind of the big unknown out there, what they're going to come in to help. And what they're going to do, are they going to be in to help with part of the tax revenue loss for the states and the cities and the counties? We just don't know that yet. So, you know, time will tell us on that. But I think you have to prepare the state for 21. I mean, it's going to be on the negative. We know that, so we're going to have to prepare for that. It's going to be several $100 million that we're going to have to figure out how to get out of the budget to prepare for 21. However, I have talked to several people on some of the financial people. They think there's a good opportunity for the fourth quarter this year, things in the third and the fourth quarter, that maybe the economy can come back pretty strong. So, you know, we hope that's going to happen, and maybe that changes those numbers. But for right now, we have to balance the budget. It's just that simple, and you only got so much money to do it. So I think it's important that people know that, because whether you're a small town in Missouri or a county, thinking that maybe the state's going to be able to come out there and help us out, to bail us out of some of this, I'm not sure that's going to be possible. So again, it's back to the federal stimulus money. That's the big unknown out there. But everything on the federal money that's coming is pretty well related to COVID-19. So it just has to be paid for that, and you're going to have to make sure that the receipts, and you can prove that whatever those reimbursements are, go to that.
Governor, the state of emergency and the social distancing and everything that's gotten us to where we are now, was any of that avoidable? Could it have been done any other way? Why or why not?
Yeah, I didn't hear what the question was. I'm sorry.
The state of emergency and the social distancing, everything that's gotten us to where we are, to the point of some of the protesters outside today, was any of that avoidable? Could it have been done another way? Or if so, why or why not?
You know, look, Missouri's going to have to use common sense here and be smart about this. The majority of the Missourians are doing what they're being asked to do. We know that just because we've seen the curve on the coronavirus. There's 6 million people in this state. Let's just be realistic about it. There's not going to be somebody out there that can separate somebody to make sure you're 6 foot apart all the time, everywhere you go. You know, we got to take that responsibility on ourselves, and people in this state do. And I think they will, because I think the majority of people is going to think of their own safety also, and the concern of that. So I think Missourians are going to step up to that challenge, but we're going to continue to recommend some sort of social distancing as these orders go through and these guidelines go. They'll be part of that. No, I'm not saying that. The legislators, they've got a constitutional obligation to do it by the May 8th, and that's what they want to do. And that's fine. We can do that. What we don't know is how much stimulus money is going to come in. That could very well maybe come in June. It may not come in. So the work they're going to do between now and May the 8th to get a budget done, they're going to craft that. We'll see what happens. If something changes drastically, then we'd call them back in. Then I'd call them back in for special session. Yeah. Well, again, that's up to the legislatures. I'm not sure what all their agenda is going to be on there, the House and the Senate. You know, really right now we're focused on the COVID-19 from my office, the unemployment issues we're having. We're working on the mental health situation, making sure the corrections There's just a lot of things we're trying to do. One, these models we've been doing for weeks. It's a lot of time. I'm not sure what the legislators are going to come up, what they're going to try to pass, or if they're going to try to pass anything, other than I know the main reason they're coming up here is for the budget, is what we know, and we're going to try to give them as much information we can to help with the budget process. Dr. Williams?
Thank you for the question, and we're intensely looking at that right now. I just got off a phone call with the White House with Ambassador Burks and Admiral Giroir. So, as you know, this is all changing very rapidly. We now, and LabCorp announced today that you can do at-home testing that they're going to make available. There's saliva testing that's coming on board. But to your question, what is the prevalence? And so you're seeing some research coming out of Santa Clara County, some research coming out of LA, looking at that. There was a study, not a study, a survey closer here. And so that's one thing we're very interested in, and we're going to talk more about is, obviously the way you normally do a seroprevalence study is with antibodies. But we won't have that capability for about 3 weeks. So we're looking at other ways to answer the question exactly. I'll tell you that if you look at the very limited research nationally, people would quote a prevalence of about 2%, maybe 3%, including asymptomatic people and symptomatic people. So I think that's a number we kind of walk around with. But obviously that number is going to be very different for Worth County and Gentry County, I believe, than it is going to be for St. Louis County and St. Louis City, where we have half of our cases. And so when you talk about it, it's going to vary around the state because it's a very diverse state. So we're very interested in that as well for the reasons we've talked about. It would help people know if they think they might have had it, but they never got tested. It would certainly help our first responders. And it also helps us, we've always committed to this being science-driven. That's why we do so much testing. And antibodies and prevalence studies using PCR will give us more information. As we transition into recovery, it would be very helpful to know that very thing, and we have a plan to kind of get us there. No, but we're working to find that out. We're working to get there. And since I'm up here just real quickly, I want to thank the governor for signing this bill today. I was at Whiteman Air Force Base about 9 months ago, and I toured their medical facilities, which are excellent. And when I asked them what would be the one thing we could do to help you, it's that very bill that was signed today. Many of those spouses are in health care. Some of them are teachers and other things, but many of them, both men and women, are in health care. And so, we have 500,000 veterans here in Missouri, and as Joe said, we have 18,000 active duty. And that's really probably, they would say, one of the kindest things we could have done for them was to get that done. So thank you, Governor, for doing that.
Right here, microphone. Michael, you'll get your chance in just a second. Michael, just a second. Go.
For the governor.
Governor, this will be for you.
So earlier in this crisis, you actually ensured that the entire state of Missouri will be eligible to receive the SBA Paycheck Protection Programs. And last week, the director, Rob, I forgot his name.
Dixon?
Yes. Director Dixon said about 46,000 of small businesses in Missouri got received those benefits, but that's actually less than 10% of the entire small businesses in Missouri. So do you have any plan or thoughts in place that would ensure that every business who apply for the program to get the benefits, sir?
We hope so, as long as the money's there. That was one of the things today. There's more money coming out for that. If that was a question you're asking of the ones that haven't got it yet, well, if they just run out of money is what happened. So today, my understanding, talking to the federal delegation, that they believe they are going to pass a bill that will have more additional funding for that small business.
Do you have any number of businesses who have applied for the benefit but haven't received the benefit yet?
You know what? I don't know whether they have or not, to be right honest about it. I assume that's in the process, but I know there's, I don't know. I'd have to check with economic development to find that out.
Thanks, sir.
All right, Michael.
Thank you very much for the questions. I've been working on that a large part of the day. As you know, in Missouri, certain counties will tell of the cases in nursing homes, and certain counties choose not to. And we try to respect that. But we learned of that last night, that CMS guidance now is that all nursing homes have to report cases. So I left the team when I drove over here today looking at that very issue. Would it probably make sense for us to report all of the nursing homes that statewide instead of leaving it up to the county? And so we're looking at that today. So that's very much on our minds about that. Again, a huge point of emphasis going forward is our congregated facilities, such as long-term care facilities. And like I said yesterday, we worked on that all weekend. And think going forward as we box in outbreaks, that's going to be something that's really important. We've changed our testing guidelines today, which we're going to talk more about tomorrow. But those testing guidelines we've changed are very much aimed at your question. Yeah, we're very strongly considering it today. Yes, I'm asking. I asked my team today to research that, see what other states are doing. It's been an issue here in Missouri because some counties do it, some don't. And so we're looking at that today.
Right here, right here.
Well, I wish we could do it that way. I think, again, just listening to Ambassador Burks on the conference call we just had, and we had all the labs on there, Abbott and Roche and all the other ones, because it was about testing. We are aware that the more we learn about this virus, that there is an asymptomatic component to it, that you probably are infectious 2 days, 3 days before you become most infectious when you're coughing and have respiratory symptoms. So we learn something new about it every day, but if that is in fact the case, as Ambassador Burks was talking about today, then that would mean what you just said you couldn't rely on, which is just wait till you start coughing, and that if you're not coughing, then you're fine. So.
All right, back over there.
Dr. Williams, does the state have any other priorities that are before funding local health departments?
Well, our number one priority is to save lives and protect health, period. And so, I think just to hark back, to an issue that came up working with our local health departments, we received some money, and traditionally we would have taken that first tranche of money and worked with, and sent that out, and we decided that we needed to spend it on PPE, to be honest with you. We just thought the most important thing. Now, our commitment to them is, as the governor says, we receive more money and we get federal guidelines, then we certainly realize that that is something they've been incredibly helpful with. But, I'm a doctor first, and the first thing we realized when we got that money working with Sandy was PPE was going to save lives. We'd have later to do other things, like fund health departments or whatever, but the most important thing was to save lives.
How will local health departments be chosen to take that money? Will it be where the most cases were, or will it be spread across the state?
I really haven't gotten to that. And I think back to the governor's point, I think that'd be putting the cart in front of the horse to decide that before we see how much money it is and what the guidelines are.
Dr. Williams,
Yeah, Lucas.
both last week and again today, that testing guidelines for the state have changed. I apologize if I missed this. What are the new testing guidelines?
Well, yeah, I hope to have them out for you tomorrow, but I'll give you a flavor of them if you would. We are going to move, first of all, to very much developing this boxed-in strategy around congregated facilities, and that's anywhere there's an outbreak. Because if you've noticed, we are not seeing as much community transmission. This is like the 12th day in a row we've had less than 200 cases, and we were seeing 300 and almost 400. So that gives us more capacity to test. But as Ambassador Burke said today, and Admiral Giroir, in the future, we're really going to have to focus on nursing homes. That's where much of our mortality is from and much of our morbidity. And so if you're going to do that, you start moving into what we call comprehensive testing. And very similar to what we did this weekend, in which you go in and you test a lot of people and you test them quick. One thing Ambassador Burks talked today is the possibility of doing sentinel testing, where sentinel meaning you're looking for people to kind of be a sentinel to let you know it might be coming. So I think that's the first thing on testing. Again, just to tip my hand, one thing we've gotten is just we had a guidelines in there about testing first responders, law enforcement. Well, one of the things was that you had to have known contact with someone. Well, first responders will tell you they're in contact with everybody. So I've been getting about 6 phone calls a day going, I've got a highway patrolman who's got a cough and a fever, but he doesn't or she doesn't know exactly who she was exposed to. So we changed that today. And there are about 2 or 3 others that we'll put out tomorrow. But, this is a dynamic situation. We learn something new every day. We're moving into a new phase. And so we always have to try to see that ahead of time and adjust accordingly.
Mr. Brooks?
Yes, sir. Huh? Yes, sir. Right. Thank you. Well, my order carries the force of law. So to answer your first question, if they deviated from that, then yes, that is a deviation from the law. When you say bad judgment, I don't tend to be, as a clinician, as a doctor, I didn't become a judge, I didn't become a lawyer. I'm more concerned about their health. That's my number one priority. So rather than judge them, what I would try to do is convince them that the governor, I think the most important thing we have to do in our offices is keep people safe and save lives. And so anything that I need to encourage people to do that, I'm going to do. I don't judge that. I'm just trying to help them. It does, by the force of law, it is a misdemeanor, yes.
Dr. Williams, can you explain how the local health orders are going to work after the governor's order expires?
Yeah.
Are they going to be able to operate under the same orders they're operating under now?
Yeah, I can't express it any better than the governor, which is simply, as he said, is that local health departments always have the ability to be more stringent. You've seen that in your, St. Louis. But they're not allowed to make them less stringent. Our orders supersede those. And so it's exactly as the governor explained it.
So they'll be able to keep parks closed if that's the best route?
Yep. They can make it more stringent, but under their existing orders, but they can't make it less stringent. Is that?
Does the state have enough PPE for healthcare workers and other workers to conduct the contact tracing and the testing needed to start reopening Missouri?
Yeah.
How much of each of those things does the state need?
I'm going to turn that over to Director Karsten, but to your point, one of the 4 pillars the governor has put in place for us moving forward is the ability to do testing and contact tracing, and so I'll let Director Karsten speak to that. But I think the wonderful thing we've done is we've got a runway here. We've got a runway of 2 weeks, and so we're having less cases now, which enables us to build capacity.
We are working in that direction every day to obtain more PPE. Today, the state just launched a website in which suppliers and those needing PPE can go onto and order PPE or locate a supplier for that. So again, through SEMA as well as DHSS, we continue acquiring more PPE every day, whether it's an order or whether that's delivery. So we're working in that direction. So thank you.
So how much PPE is still needed?
I don't have those exact numbers as far as what is still needed. I can just tell you it's a lot in millions.
How many days worth of PPE would you like to have in order? Part of this reopening strategy relies heavily on PPE being on hand. How many days worth of PPE would you like for those healthcare workers to
ideally as much as possible. We know that as a general rule, 14 to 30 days supply is the general rule. Thank you.
My question is for Dr. Williams.
Let me just answer a question on the PPE side of it. Some of the things we're doing on that. I think one, it's also important to realize that for a long time we thought we was going to get it out of the federal stockpile or the state stockpile. That's where everybody thinks. We're well aware now that the hospitals, the first responders, the fire departments, the police department, all on the local level have the opportunity to buy PPE gear now too. And so you're seeing that with a combination of what we're doing to build up our stockpile plus them. So the hospitals for normal rule would like to have, for example, maybe 14 days supply or whatever it might be, whatever their guidelines are that did tell you that. But I think that's changing daily as we speak along with the testing. I do mention one thing about testing too. I was on the phone today with the commissioner, I believe it was in Cass County, and also with Congresswoman Hartzler. They mentioned there was a company up there that now, and you maybe already know it, I just found out about today and we're checking into it now, that has offered to do 100,000 tests in that county. So that's a little bit of breaking news for us here in the state. Congressman Hartzler talked to me about that today. So that's good news if we've got a company that's coming online that can be able to do that. So I just wanted to add that on the PPE side of it. Dr. Williams, I think she had a question for you.
So studies have shown that COVID-19 is disproportionately affecting African Americans. You said that Missouri hospitals have failed to, a lot of them have failed to report that data. Have you seen a change in that?
Yeah, I asked that this morning, and I'm told that we were at 31% of unknown, and we're now down to 20% unknown because I've asked us to go case by case for our deaths in Missouri, and if they're not being reported, then we're going to go find it. You know, you can find it. I mean, it's going to be on death certificates. It's going to be in cases. So I've asked my staff, Adam Crumless, I put him in charge of this, our deputy, to find me every case. I mean, I did this for 30 years. You can find that information if you look. I mean, I wish people by law would report it. If they're not, we're going to go find it because it very much demonstrates our strategy. And again, just to layer on what the governor said about the PPE, one of the things as we phase in is hospitals are going to want to do elective surgery. And to do elective surgery, you have to have PPE. So much of the onus to your question is going to be on them. It would be irresponsible to be doing elective surgery if you didn't have enough PPE to cover your emergencies. So that question will in many ways answer itself about what is the right number, because they are going to be required to have enough PPE. They can't be doing elective surgery if they don't have any PPE to cover their emergencies. No, not find as in F-I-N, but find as in we're going to go find it. I mean, I've done chart review all my life. You can go find this information. We've gotten it down to 20%. We're going to keep going until we get it to 100%.
Another question about that. We've seen in New York City that the governor there is putting testing sites in areas that are more diverse. Are there any talks about doing that here?
Again, it's been a busy day. We talked about that today. There's an area in Kansas that I hope by 5:30 I have the plan how we're already doing more mobile testing there. The governor, I had a great meeting with the clergy who pointed that out, and we've talked to Quentin, and so, but now we're going to add even more, and I'm very excited about that. We'll be talking about that probably in 2 days, but we're going to go into very specific areas. I was on the phone with the mayor of St. Louis today, and we talked about that. I don't think she'd mind me saying that Barnes Jewish told her they had 12,000 swabs. So that's very exciting to us because that's kind of a critical component to doing testing. And so work very closely with her. As you know, we've opened up 5, at least maybe 6 now, testing sites in North St. Louis County and North St. Louis City. And we just want to make sure that in those areas, but I'm getting a little bit ahead of myself, but to make up, we've been asked about seroprevalence. One thing we're very interested in doing is going into Kansas City and North St. Louis and looking at prevalence. And we have ways of doing that, through our testing that will answer 2 questions. One, do symptomatic and asymptomatic people have exposure to COVID-19? So that's going to be one of our priorities, is to look at that because we see more morbidity there.
Doctor,
Yeah, Lucas.
I guess 20% unknown. Would you mind sharing of those known cases how the deaths break down by racial demographics?
What I was told, I have not seen the data myself, was that it was, and I wasn't given a number, but that the majority were Caucasian. But how much of that majority, I don't know. Adam Crumlis is the one that answered that question for me. I called him at.
Governor, we have time for one more question. Philip?
Governor, I know I think it was last month that the Department of Homeland Security put out the guidance of what is essential and not essential. But can you kind of walk through for Missourians again how you actually reach those decisions in your stay-at-home order, how you concluded what is essential and not essential?
Yeah, well, I'll go back to an issue that I was troubled with to a certain degree is who gets to decide who's essential and who's not essential. I think that was one of the biggest issues that I faced as governor, trying to select who those people were, you know. And for me, when we open back up, to me, everybody's essential. Every worker is essential because, you know, so many times when you hear that word non-essential, essential, when that all first started, look, everybody was scared. There's a little bit of panic in there, and we just started saying, okay, what is it we really need? So we started declaring non-essential businesses and essential businesses. What we do know now, looking back on it, again, every day you learn something. We know we were literally funneling people in to stores that were, quote, essential, was creating a worse problem because we were now bunching people up in the problem, or was creating more of a problem. Let me just put it that way. So here's the trouble I've always had with that. When you start thinking of a business, a lot of times we think of brick, mortar, and glass. The reality of it is that business belongs to some person. Some person works in there, and all of a sudden, some way, we decide who's essential or who's not. You're actually saying that person is non-essential anymore. And then you send them home, or you send them home to their family. And you almost, to a certain degree, say, what does that say about him and his family together? So it sounds good when we talk about it up here from a podium or we talk about it in the media, but the reality is we're making a judgment call on really who is essential and who's not in life in general, and that was something I've always struggled with. But when we reopen, we will be making sure that there's probably no, quote, non-essential business. We're going to take a look at it. We'll see what risk we have in all those areas, and we'll start targeting the risk on open businesses up across the state of Missouri.
All right, thank you.
All right, thanks everybody again. Appreciate it. I think we're going to do this, Kelly, Thursday again. Is that right? Okay. We'll be back here Thursday again. Thank you very much for being here today, everybody.